Good afternoon, everybody. Welcome back to this session on economic security for families and individuals. My name is Brad Paul. I'm the executive director of WISCAP, which is the Wisconsin Community Action Program Association. I hope that many of you are familiar with our association, at least at the local level in the communities where you do work. We have 18 member agencies across the states, rural, urban, suburban, everything in between. From top to bottom, left to right, we're all over the state of Wisconsin providing a range of services from housing assistance to food security to workforce development and a whole range of social services. Many of you probably are most familiar with some of our work helping administer the TFAP program for the state of Wisconsin. So really pleased to be here, really honored to be invited to help facilitate this very important panel on economic security for families and individuals. So our premise for this session is a very simple one. It's that when families and individuals are economically secure, they are food secure. And that is very true. And our panelists are going to begin to unpack that in a very integrated way. We want to talk about where housing and incomes and health and food security all collide, how they all relate to one another, and then get into some level of detail based on the specific work that our panelists do. So to do that, I'll shortly introduce our panelists. Let me just say, just by way of maybe sort of framing this just a little bit from my perspective, and then we'll get into, as your program says, the experts, which I am most definitely not one. That's my panelists are. I'm just here to sort of shepherd things along and make sure we move about. But this is obviously a very important discussion. And I want to thank Stephanie and Feeding Wisconsin for making it possible. You know, it's become a bit of a cliche, I suppose, over the last several months to talk about how the pandemic has revealed certain things about our economy, about poverty. And it's true. It most certainly has. But we also know that there was a very intense awareness of these issues before the pandemic. And so when we talk about revealing something, in some ways, what we're really talking about is revealing solutions, not so much the problem. Because we know that before the pandemic, and I can speak about housing in particular, since it's an area that I know quite well. Think about this for a minute. We had, prior to the pandemic, we had over 300,000 Wisconsin renters who were paying over half their income for housing and received no public assistance. So HUD calls that worst case housing, and that is people who are at the greatest risk of homelessness, of eviction, of general housing insecurity. And they're, as I said, they're spending over half their income on housing, which leaves very little for other items, including food and childcare, et cetera. In addition to that, and this is something that generally is, and it's scandalous, but that people don't realize is the extent of homelessness in this state. Every year, the HUD comes out with a number and says on any given night, this number of folks were homeless, but it only counts people who can be identified in shelters and on the street. What it misses is that over 18,000 kids have been identified as homeless through the public school system. And these are kids who are living doubled up, who are living in motels, weekly motels at best, but aren't considered homeless by the HUD definition. So we have a real problem there in terms of housing security if you just take those two top line numbers that I gave you. So these and we can extend this, and you'll hear more about this when Tim and Sara and Doua talk. This extends into other areas too. It's just that the pandemic has allowed maybe more people to become aware of this as insecurity spreads into some new areas of the income bracket. But what it's revealed for me is the solutions. And we know that last summer and fall, when the stimulus checks went out, it had a real positive impact on households. And then we know more recently, and we're already starting to see some pretty significant changes, is the impact of the tax credit. And Tim is going to go into detail about that. So we're starting to see that maybe, just maybe, moving off sort of this reflex of incrementalism that sort of locked us in place for 40 years now, can make a difference, that policy matters. And I know that's something that all of our speakers will talk about today. it's possible to have a new deal, if you will, right? It's possible to have a new war on poverty. And I would argue that we've sort of been conditioned over the last 40 years to think about the limitations of what we can do as government has shrunk. But I think maybe that what the pandemic has revealed is that maybe we do need to think big again and have to think big again. So that's kind of where we're at from where I sit. And now what we want to do in this session is have a conversation, and we want to talk about the intersection of the issues that we work on when we talk about economic security for families and individuals. And to walk us through that are going to be our three panelists today. First, we'll hear from Tim Smeeding, a professor at UW-Madison. After Tim, Sara Finger from the Wisconsin Alliance for Women's Health will speak to you, and then Doua Vang from the Southeast Asian Healing Center will round out our panelists. They're all going to take somewhere around, I think we agreed about 6, 7, 8, maybe 9 minutes, maybe 10, maybe more. I guess that's up to the panelists ultimately, but that's kind of the general guide. And then we're going to throw it out to the audience, all of the participants, to open this up for discussion. To begin to try to make some sense of this and hear from people's perspectives from the field and elsewhere. So to get us started, I want to introduce my friend and colleague and all-around amazing, accomplished policy guy who's really at the center of a lot of attention these days for the information he's going to share with you. That is Tim Smeeding. And Tim is a professor. He's the Lee Rainwater Distinguished Professor of Public Affairs and Economics at the La Follette School of Public Affairs at UW-Madison. Tim, from 2008 to 2014, was the director of the Institute for Research on Poverty, also at UW-Madison. That's an institute that is constantly churning out provocative, important studies, bits of research. WISCAP, my agency's partnered with them many times over the years in many things, including the Wisconsin Poverty Report, which Tim has been the lead author on. He was also the 2017 John Kenneth Galbraith Fellow of the American Academy of Political and Social Science, and a member of the National Academy of Sciences Committee to build an agenda to reduce the number of children living in poverty by half. And he was the co-author of a report, A Roadmap to Reducing Child Poverty, released in 2019. And this was a very significant publication and set of recommendations, as it really set the stage for these the new universal monthly child tax credit program. So Tim's policy work and research finds its ways into very practical, meaningful policy changes for the work we're here to talk about today. He's recently co-authored a book, SNAP Matters, which is a great title, by the way, Tim. And he is has been a visiting scholar at the Center for the Advanced Study of Behavioral Science and the Russell Sage Foundation. His recent work has been on inequality in income, wealth, and consumption, social and economic mobility across generations, a child allowance for the United States, and poverty, especially for children in national and cross-national context. And that is very, very important today. What Tim has been working on has been a long journey, and we are really at a very crucial and significant moment for the work that he spent a long time advocating for, a real game changer, as the saying goes these days. To find out more about Tim, I'd encourage you to go to the La Follette School website, and you can find his CV there. So with that, I thought we all thought it'd be a perfect way to get this thing started with Tim's presentation, to sort of lay out where we're at and where we've come from and the significance of this moment. So Tim, I'm going to hand it over to you.
Thank you, Brad. Hi, everybody. I'm Tim, that's all. But I put a little PowerPoint together for you today to talk about the federal and state policy role in reducing hunger and food insecurity. Stephanie's going to forward the slides for me. And we're just going to walk through what's been going on and how it's been helpful and then hopefully it'll help us understand how federal policy interacts with the local policies that we see through Feeding Wisconsin, through all of our food banks, our food distribution networks. So next slide, please, Steph. Aha, here we go. Food matters and policy matters, okay? Income support policies are never going to be as flexible as direct food aid, which is always needed. We need Feeding Wisconsin. We need the River Food. We need all sorts of River Food Bank, other food banks, food pantries, and groups like Feeding Wisconsin. We need that. But federal policy can help reduce the burden on them. I think of the food networks and the people I'm talking to as filling in the cracks between the blocks which are produced by the public system. So I'm going to give 4 points of takeaways. It's mostly about children, although I fully understand feeding elderly people is important too, and students who otherwise don't have a lot of income, and literally feeding everybody. So here we go. I have to be able to see my slides first. There we go. The first point I'm going to make is the pandemic. Go back. Oh, okay. First, food matters. Let's start with that. Okay. And then we're going to go to pandemic EBT, the role of the child tax credit, the role of the new permanent SNAP increases that are coming this month, and the importance in keeping these two policies beyond 2021. So next slide, please. Food matters. There's excellent long-term causal evidence that a variety of economic and social outcomes for low-income people, especially kids, can be linked to federal food support programs. Early investments have a large health payoff on low birth weight and infant and maternal health, on longer-term health, and a host of schooling outcomes for infants and mothers in particular. All of this, there's an appendix, and Steph has the PowerPoint. She can put it up. A lot of Diane Schanzenbach's work and other people's work exactly spells out the importance. So that's where we were. We knew that when we started our National Academy of Sciences report on having child poverty, and we made that statement in the report, and it's fully accepted. For the first time, the federal report says there's causal evidence that food matters, that income matters. But COVID brought new challenges. Next slide. We've all seen these, and we've seen these pictures and how important they were. We've seen long lines for food banks. We've seen neighborhood food aid stations passing out food to the elderly and the disabled. We've seen refrigerators on city blocks that are stuffed with food for people to take them. We've seen lunches provided even for kids who weren't in school and so forth. So there was a huge effort during the COVID time to try and feed people. And it was fairly successful. Next slide. In the pandemic school year, we reduced the share of families in SNAP households where children experienced very low food security by 17% through extra benefits and so forth. Okay. We reduced food insufficiency among all SNAP households by 28%. And we had the largest effect in states with relatively high rates of school closures, where the pandemic benefits reduced children's very low food security by 22% and food insufficiency by 39%. This was an excellent effort, but it was off and on. Okay, as you'll see, there are some bumps in the road. Benefits came out, then they went away, came out, and went away. It took a while to get people into knowing that even if their kids weren't in school, they could get school meals and so forth. But the crisis and the urgency did prompt two other recent changes that further cemented our progress. Next slide. There, you can see food insufficiency on the left there, and for everybody in blue, and for families with kids in the yellow, you can see it was fairly high. And it rose right after the oncoming, as we headed towards the end of December 2020, going into it. Along came the pandemic benefit in January 2021, which made a big EBT, which made a big decline. Then first came an increase in SNAP benefits, actually. That's the light pink line. The dark pink line was the economic impact payments. Both of those did a really good job, but they ran out this summer. Okay. And food insecurity for everybody and for kids was trending up. And then came the child tax credit, which certainly moved the green line down a whole bunch. And those are the things I'm going to talk about. Next slide. The new credit is a revolution in U.S. social policy. Most families with incomes under $250,000 are now, since July, receiving $250 or $300 a month per child to support their children. 3 kids, $750 to $900 a month, depending on how old your kids were. Okay. The system is akin to what we call a child allowance system in other countries, and the universal policy is based in the idea that kids are expensive and society has a shared interest in seeing them thrive. Under the old child tax credit that we had before, the bottom 35% of kids either weren't getting the full credit of $2,000, but now everyone's doing much better. Next slide. Okay, so we had a child tax credit, $2,000 per child per year, available with kids up to $400,000 a year from 2017 on, but refundability was limited. The bottom 10% of families with no earnings got nothing. The next 25% only got partial refunds. So the people who needed it most weren't getting it. But for 2021 only, the credit is fully refundable, and it's up to $300 a month or $3,600 per year for kids under 6, $3,000 a year for kids 5 to 17. Okay. The first half comes monthly, and it started in July. The second half comes as a tax credit when 2021 taxes are filed. And it continues all the way up to $112,000 for single parents, the full credit, and couples to $150,000. So 90% of the U.S. kids are getting credits, and we may even have child poverty. Next slide. Okay, so it's paid monthly to eligible parents of all kids with Social Security numbers. And it includes the U.S.-born children of immigrants as well as other citizen kids, like our citizen kids, most of our citizen kids. Once you're eligible, once you're enrolled, and that's a key, getting people enrolled, you don't have to recertify, reapply. There's low administrative burden. If family situation changes or if your income grows enormously, there'll be changes, but otherwise it should just keep coming. It's going to give a floor under family income and reduce month-to-month income instability, highly valued by the poor. Okay. And this credit is not counted as income against any other means tested program. So the fact that you get $300 a month, let's say, for your 6-year-old, for your 5-year-old, in terms of a child tax credit, does not reduce the amount of SNAP or food share you get. It does not reduce your SSI or your Medicaid. Okay. It doesn't affect the earned income tax credit, which is separate. So if you go out and you earn money, you get more from the EITC. Half of the benefit is coming right now until December. The other half at tax time in 2022. Okay. Since the CTC is not reduced as earnings rise, it doesn't discourage work. If you earn more, you get less SNAP, but with the child tax credit, it's flat. You make over $100,000 a year. Next. The effects are visible. The new child tax credit program is associated with an 8 percentage point or 29% fall in food insufficiency for low-income families in its first month. The Census Bureau compared food insufficiency with families with kids and adults, non-aged adults who had no kids, and the difference was this big for those getting the child tax credit with 8 percentage point fall. The effect is concentrated in lower income families where we still have some take-up problems. We need to increase take-up. Other census reported effects included declines in families who find it difficult to afford household expenses, increased spending on debt reductions, emergency savings, and increased expenses on childcare. All of those things happened because of this payment. They've all begun. Next slide. Now, the broader goal, of course, is to stabilize income and reduce material hardships of all kinds. Not enough food, inability to pay bills, including rent, okay, as I mentioned below, and anything else due to lack of income. It's important because hardship is associated with a host of other adverse outcomes. For instance, the increased risk for child maltreatment, child behavior problems, intimate partner violence. All of this happens when there's tremendous pressure on the family because they don't have enough income. This benefit will help relieve some of that pressure. For an example, Brad mentioned housing before. 1/4 of all evictions in our country are for $500 a month or less. If all you've got this month is the only cash you've got this month, let's say, is your, and you have 2 kids or more, from your CTC, you can pay your rent just with that, okay? Well, there's more in the addenda on who's helped and why it's a good investment in poor kids, but I won't get in any more into that now. Next slide. Okay. The next is SNAP, food share. Many of you may know that the feds recently revised the nutrition standards of the SNAP program that feeds 1 in 8 Americans, 42 million people today. Okay. The revision led to the largest permanent increase in benefits in the SNAP program's history starting this month. Now, it's very interesting. The review of this food standards was begun under Republican presidency, completed under the Democratic presidency, and the bottom line was it wasn't enough. The old food standards that we've had weren't enough. So the rules increased average benefits by more than 25% from pre-pandemic levels. That's another 10% on top of the economic recovery plan increase. This move does not require congressional approval, and unlike the large pandemic area expansions, which are expiring, these changes are long-term, at least until somebody else decides to change the levels. Next. Okay, why did they do this? More than 3/4 of households exhaust their benefits in the first half of the monthly SNAP cycle. We know this. You've seen this. You know this. That food bank demands and feeding center demands go, and food pantry demands go up when the SNAP benefits run out, usually after a couple of weeks. Okay, and once these things have run out, subsequent food shortages can lead to increased hospital admissions, more school suspensions, lower SAT scores. This has all been worked out. So you guys help there fill in once SNAP is gone, but now SNAP is going to go further. So the Department of Agriculture has gone and revised the Thrifty Food Plan so that the cost of the economical, minimally nutritious diet since 1962 has been updated. And the good news is the new standard reflects the true cost of a basic healthy diet, not what poor people can afford to spend. What this means is pretty straightforward. What we've done is we said the new standards were not done according to the cost of an adequate diet with people who couldn't afford one. They were done with the cost of an adequate diet for anybody. And those are the standards that are applied. So this is a new increase, a massive increase, I think 25% increase in SNAP benefits that will make them go longer. Next slide. Almost done. And so the good news is it'll last longer. The older maximum age couldn't buy a modest diet in 96% of counties. But unlike the CTC, which is administered by the feds, SNAP is administered by the states, and hence it's really 50 or more programs. And the administrative burden, the reapplication process, whether there's a liquid asset test and so forth, varies greatly by state, okay? And even within states over time. So consider Wisconsin's history, okay? Back when I moved to Wisconsin, I joined Jim Doyle on his poverty task force, and we made sure that everyone knew about the SNAP program. We got rid of the liquid asset tests. We stopped the home test. We didn't penalize you if you had a car that cost more than Blue Book value of more than $4,000. And everywhere you went in Wisconsin, any program you applied for, you found out about food share. And we got 1 in 7 people being fed without question during the Great Recession, and that did a great job in holding back the increase in poverty during that bad time in our state. Fast forward to Mr. Walker about 3 or 4 years ago, particularly after Mr. Trump came in. We cut benefits for able-bodied adults without kids. We forced them to go to work. We had asset tests. He's talking about drug tests. He was talking about home value tests. But most of the bad news there, including the 30 hours a week work test for mothers with kids who were getting benefits, were all suspended when Evers was elected. So SNAP helps, and SNAP's good, but you have to give people access to it. So that's really important. And the less access there is to SNAP, the more demand there is on food pantries and other people associated with Feeding Wisconsin. Next. You can see in this graph the importance of keeping SNAP. You can go right along the lines, and you can see the top yellow line. Okay, the stimulus checks come out, hunger fell. The hunger line for if you didn't have enough to eat, the hunger line for families with kids is at the top, and the blue is for all households. It fell. Okay, in January 21, the SNAP benefit increases by 15% help, then began sending the stimulus checks, and those were running out and people were coming back up, and then the child tax credit kicked in. And that only takes us to August. Okay? The October 21 SNAP increases and more enrollment of CTC families should push these lines even lower as we go forward. So federal policy is helping right now, and it's helping a lot. Last slide, I think. Next slide. What's next? We have to extend it, the child tax credit and the child independent care tax credit, which subsidizes child care, beyond 2021. And it's in the Biden budget, and it needs to be decided within the next few weeks. We have to pay for the investment with higher taxes, and we need to get more of the poor signed up by year's end. I've been working with a numbers of groups all over the state, with WISCAP, with the extension, with child care health workers, with all sorts of nonprofits all over the state, trying to make sure that we sign up the people who weren't receiving them and make sure they get their benefits. And we're going to keep doing that, and we have to keep doing that if we want to reach all of the poor. So the bottom line is that the refundable CTC is good for kids and larger society. Okay? We failed at universal health care for all. We were the first with universal K through 12 education. But now we've almost have universal income support for kids, and families will spend that on food if they need to feed their people. If they're getting SNAP benefits or of other income, they can use some of this benefit to go out and increase their work effort by paying for childcare. They can pay for rent. They can pay for whatever they need with it. And there's evidence that it's working right now, particularly for working class families, but not for all the poor. So next, I think that's all. Last slides. Okay. Why now? Benefits outweigh the costs 8-1. We can reduce poverty and increase market work effort at the same time with things like the child tax credit and child care tax credits. We can improve upward mobility and opportunity for kids. Insecurity has been rising for the working class, for rural and urban blue-collar families, as well as for the poor, but the CTC's been doing its job. Lots of groups like it, and it's got a 77% approval rating. Next slide. And final thoughts are, we got to keep working at it, okay? The Wisconsin Council of Churches, UW Extension, child health workers, community health workers, public libraries, WISCAP, everyone's out there trying to help people and to answer questions even after they're getting the benefit. For example, from last week, will I have to repay it? No, you won't. And from last week, Why did I get this check? Was it a mistake? No, it's for you. So if you need any help, and if I can help connect you with the child tax credit in particular, or the SNAP people in the state, just email me at smeeding@wisc.edu. Thank you very much. I'm done.
A huge thanks for your work on this. This is a major development in our collective efforts, and in no small part to your tireless work on this over the years. So thanks for sharing some of that information. One of the things Tim mentioned, which I think is important to sort of allow us to continue to really understand the significance of this, he referenced the really small amount of dollars that often prevent a family from eviction or separate them from eviction. And I can tell you, my agencies throughout the state have been helping implement the Wisconsin Emergency Rent Assistance Program. And to date, just to give you some sense of the scale, just to date, we've gotten out about $70 million with about 16,000 households benefiting. And that does not include the larger population centers in the state: Milwaukee, Dane County, City of Madison, Green Bay, and Waukesha. So the investments through something like CTC can help bleed into areas like housing security as well, for the reasons that Tim mentioned. And so it's a significant change in what we're able to do. And that's why it's important to make that permanent. So let's move on to our second panelist, and then we will move throughout our program and then open it up for discussion after our third panelist speaks. But first, let me introduce to you Sara Finger. She is the Executive Director of the Wisconsin Alliance for Women's Health. She's been in that role since 2004. And leading the effort to develop a new organizational coalition designed to unite, coordinate, and amplify the voices of women's health supporters in Wisconsin. Prior to assuming this role as director, she was the Northeast Director of Membership and Professional Relations for the Wisconsin Medical Society. She received her undergraduate degree in political science from the University of Wisconsin at Eau Claire. In 2009, she was with the Mid-American Public Health Leadership Institution as a fellow and is the past president of the Wisconsin Public Health Association. In 2010, Sara received a Champion of Women's Health Award from the Wisconsin Women's Health Foundation. In 2011, she was recognized by the Wisconsin Women's Health Foundation, with the Wisconsin Coalition Against Sexual Assault with a Voices of Courage Award. In 2012, she was honored with a Health Watch Wisconsin Award effort for her coordination work on the Save Badger Care Coalition. She's been received an outstanding alumni award from UW-Eau Claire. She was named as Woman to Watch by Brava magazine and was named a Champion of Change by the White House for her work related to the Affordable Care Act. And finally, in 2015, the Business Forum of Madison honored Sara with a Athena Young Professional Award. So you're catching the theme here, I hope. This is a very accomplished person I'm introducing. This is a pretty amazing set of credentials and honors. So Sara has done remarkable work in many fields. Her organization is dedicated to ensuring that every woman in Wisconsin at every age and at every stage of life is able to reach her optimal health, safety, and economic security. And the organization fights for policies that can help improve not only women's physical health, but their economic and mental health as well. And to do this, they partner with organizations statewide and nationally, work in coalition to raise awareness and policy opportunities to improve overall economic security, which makes for the perfect segue into what she's going to talk about in the integration of our various work experiences here today. So with that, I'm going to hand it over to Sara. Thanks, Sara.
Thank you, Brad. Hopefully everyone can hear me okay. It's really great to be with you all. I know it's probably the afternoon lull, so I'm going to try and inspire you all to really embrace the power of policy. And Michelle, I could not have asked for a better cue up to what I'm about to talk about working upstream. And that's exactly what our organization is all about. So Michelle Pride, thank you for your comment in the chat. As noted, I am incredibly honored to have founded the organization, the Wisconsin Alliance for Women's Health, back in 2004. At the time, I'm from Milwaukee originally. I went to school in Eau Claire, poli-sci major, and I was hired to really help address the increasing legislative attacks on women's health care in our state legislature. And so, not assuming I knew what that meant, I did 65 listening sessions across the state and really came to understand that, women's health and well-being it's not a one size fits all, and it means something different to different communities of women and families across the state. And as a woman, as a mom myself, I know that there is any number of things that could make or break my day and my ability to be whole myself, physically, mentally, financially, and then obviously to make my family whole, my community whole, my workplace whole. So our organization looks at policy threats and opportunities at all levels. So big P policy, what Tim was talking about in our nation's capital, other big P policy like in our state capital in Madison, but also policies in workplaces and policies in schools, policies in hospitals, policies in communities, community gardens. And so there's never a shortage of outlets and places for us to be influencing and informing policy and systems change. Our organization, just at the be all end all, is that we just really believe policy and systems change should happen with us instead of to us. And unfortunately, because we, have the society we have where we really don't cultivate and condition young people, especially, to grow up appreciating the power of their voice and the opportunities to inform policy and systems change, we have a lot of people sit on the sidelines of democracy. And I often talk about how there's a policymaking kitchen. And I'm going to use a lot of analogies today, but the problem is, if you're not somewhere in that kitchen at some point in your life, you're on the menu. And that's just what has happened around all these different policies. And the comment made, from Brad and from Tim, that there's a spotlight that has been shown on failures of deficiencies in policy and systems change for a very long time, thanks to COVID. And I do, Michelle, I do see such urgency to Band-Aid and to work downstream and to definitely help those in crisis right now. But our organization really tries to look at opportunities upstream. What can we do to change the trajectory so that we don't have so much food insecurity, housing insecurity, economic insecurity. And there's no shortage of evidence-based policies available to us at the state legislative level, in our nation's capital, and in policies, even city and local, to help work upstream. And so we really were a small, scrappy nonprofit based out of Madison, but we work with all 72 counties. And again, we know that we can't just focus on women's health care and ensure, coverage for breast cancer screenings. A big part, as you heard, a big part of our agenda over the last decade has been around affordable, quality healthcare access and the Affordable Care Act. And so that, yes, is a physical health issue for women and families, but it is an economic security issue in terms of being able to afford the care you need to, again, hopefully get yourself as healthy as possible and prevent any catastrophic health situations. So I just want to recognize the intersectionality of that. And we purposely, again, wanted to connect the dots. There's a lot of silos that exist around women's health care, and there's reasons for that, right? The Wisconsin Coalition Against Sexual Assault came to be because of needs to address violence against women. And the Wisconsin Breast Cancer Coalition and the National Alliance for Mental Illness and Planned Parenthood, there are all these great organizations taking on aspects of women's health and well-being. And we as the Alliance for Women's Health, again, really recognize all the things from housing, nutrition, incarceration, education, environment, all those things. It really does either make it possible to sustain and thrive in society, or to really just be buried by all of the negative consequences of things. So I don't have a PowerPoint, and my colleagues, Tim, I think he's going to cover the academic portion of this panel today, but I'm just thrilled to join all of you and to talk a little bit again about how important it is for us to somehow find our way into that policymaking kitchen and to work upstream. I don't imagine, Michelle, you're the only one that feels like, what are we doing? All the funding and all the efforts to Band-Aid things. What could we be doing around creating that kind of financial security that allows people to be whole and not be in this state of crisis? And another big policy we're working on is paid family medical leave. And we knew that was a problem before, and COVID just shed a really harsh spotlight on how many people were struggling not having the ability to take time off to care for themselves or a family member without losing their financial stability. Paid sick days, affordable childcare, a living wage, minimum wage, predictable scheduling. Those are all, and I put a link in the chat to our policy prescription. Those are all policies that we fight for. Equal pay for equal work, because we know those are all, again, critical to helping us again, piece together an ability to care for ourselves and our families. So those are a lot of policies, and we don't need to get into the bipartisanship of things today, but unfortunately, as Tim kind of outlined in his presentation, making it harder to get access to benefits like SNAP or Badger Care access, the barriers continue to be put up instead of looking at opportunities to really open the doors, work upstream, and to help individuals, again, change the trajectory so that we're not in this place of crisis. I don't know, I can probably stop there and let Doua give an introduction. I know our introductions are only supposed to be like 10 minutes. So I'm gonna go ahead and pause there, and I encourage anyone to put questions in the chat, and I know Brad will bring us all back in to continue this conversation, but I think I'll pause right there and hand it over to Doua.
Thanks, Sara. Can you hear me? So Doua Vang is the executive director of the Southeast Asian Healing Center, where he has been since 2018. Prior to that, he worked for 25 years with Journey Mental Health Center as a program manager. And there his job was to develop programs and services that met the needs of the Southeast Asian population in Dane County. Similarly, in his current role at the Southeast Asian Healing Center, Doua works to provide mental health case management and activities to help the Southeast Asian population. And this extends beyond mental health to provide support in the areas of hunger, asset building, housing, and food security. And so with that, I'm going to turn it over to Doua. Thanks, Doua. Still on mute.
All right, I'm still mute. Okay, sorry.
There you go. Thanks.
Yeah.
Yep. You're
all right. Hi, my name is Doua Vang, and I'm saying that earlier I was having problem with the camera, so I couldn't get my camera to work. But thank you, Brad and Tim and Sara. I've been with the Southeast Asian Healing Center for 2 years now, and I would just have to go a little bit about the history of the Hmong and how we get here and the population. I'm sure that many of you may know who the Hmong are and what is the population in Dane County. The Southeast Asian consists of Hmong, Cambodian, Laotian, and Vietnamese. But my talking today will pretty much be the Southeast Asian Healing Center and about the Hmong. And currently we have about 327,000 Hmong population in the United States, and about 50,000 in Wisconsin. So most of the Hmong population probably live in Milwaukee, and a few thousand here and there. Warsaw, Sheboygan, Appleton, Madison, La Crosse. So Wisconsin has about 50,000 Hmong, and California is the largest, Minnesota and then Wisconsin. And Hmong people are pretty much animism, believe in culturally believe in spirit. All thing has a spirit. Many have converted into Christianity, and we have about 18 clans named, but I'm not going to go extensively with the names. You will hear lots of common names like Vang, Tao, Yang, Mua, Lor, those, but it's about 18 clans named. Hmong used to live in a simple life, and the first generation who came to this country way back started coming to this country in 1975. The first generation are mostly who are very low skill in job skills or low education. The second generation has a chance to attend some schooling and some job training. Then the third generation are those younger who are more tuned into the American lifestyle. Hmong population mostly a farmer or either farmer or involved in the CIA war in Laos. Hmong has the largest poverty rate in the United States. The poverty rate for the American population is about 13%, and then Hmong it's about 17%, 4% higher than the general populations. And at the Southeast Asian Healing Center, we are providing services to the most vulnerable population, like Brad mentioned earlier, who are 60 and 75 years old, and mostly women who lost their spouse during the war, and almost all of them are disabled and widow. So they are low income and limit income, very low income and limit income. And one of their main concern is security in life. This could mean security financially or security in foods. There's an expression in the Hmong saying that no matter how hard life is, as long as you have a roof over your head and food on the table, then you can look forward to the road ahead. And this expression has been carrying on for a long time, generation through generation. So in the last 2 years during the pandemic, Southeast Asian Healing Center was able to partner with the Second Harvest Food Bank to provide food security for our elderly population who are vulnerable and affected by the pandemics. Many of these family lost their family member lost their jobs and income, so they are devastated by the pandemic. So we were able to partner with the Second Harvest to provide foods to this population. And like I said earlier, if you get food on the table and the roof over your head, then you can look forward to whatever difficulty road ahead. And our job is to help these elderly to function better in their home, so give hope to the younger generation to move forward. And again, most of the Hmong family live a simple life. You will see a lot of them farming, and also a lot of them are working in the farm to set up booths in farmers market. These are they're produced during the summertime to help with the family. These are the food security that they're providing to the family in addition to whatever we can get from the Second Harvest Food Bank. So This is a really important that we make sure that elders feel secure, like I said, secure in financial, secure in foods, and secure in their life. And due to the fact that they have been dislocated for many years during the war and coming to this country, they want to feel secure. So I won't go further than that. And if you have any question, I will be happy to answer and put it on the chat, and we can answer. Then we really appreciate that we can partner with the with the second Harvest Food Bank to provide food for our elderly population who are disabled and vulnerable, so they can feel much more secure in their food security. Thank you. Okay.
Excellent. Thank you. So now we're going to sort of open it up to sort of a response, reaction, anything you've heard. We have the chat feature for that. And then I want to ask our three panelists to further sort of unpack some of the things they're working on and perhaps some of the both the policy and the programmatic implications. I thought the question, I apologize, I didn't catch the name, but Sara responded to one of the chat questions about sort of this meeting people's immediate needs versus longer term solutions. And that's certainly an important thing that I think we all wrestle with. Certainly at my agency, we spend a lot of time trying to figure out the fine line between meeting people's emergency and immediate needs and the more systemic solutions to addressing poverty and wealth inequality in this country. And that's why I think, among others, Tim's work is so important, that we have a sustainable attack on some of these inequalities and insecurity. But anything that the three of our panelists want to tackle or bring up while we wait for some questions to filter in?
If I can go, Brad, I just, in terms of this idea of, working upstream and changing trajectory, it's such a hard ask of people because we're all, again, seeing such immediate need right now, right? And sometimes, in the world of policy, it can take 6-10 years to see success, in getting something. We're still one of only 12 states in the nation that hasn't expanded our Medicaid program. There's things that we're waiting for, right, for the right time, but you don't eat the fruit the day you plant the seeds. And so much of what we're doing right now is really, again, asking people to be part of that policymaking kitchen, which a lot of people stay away from because they think they need to be a sous chef, right? You think you need to have a PhD in that topic in order to engage with legislators or policymakers. And I've really owned the nickname that I've been given, which is an advocacy doula. If you're familiar with the doula concept, having someone help you through what is often a foreign, scary, complicated thing and having a baby, the idea of, our organizations like ours and others helping people doula and navigate through the policymaking process, it's just absolutely essential that we figure out how to overcome those barriers that keep us from, again, engaging with policymakers, because there's a bubble right now. And, most people, we estimate that less than 7% of people in the state of Wisconsin can identify who their state legislators are. And so that's a huge amount of people that are not aware of who works for them in our state legislature. Then they don't know how they're acting on their behalf. And then it's hard to hold those individuals accountable. So as much as we're showing, a dire situation and we're talking about a lot of complex policies today, sometimes it's just a matter of, first going to whorepresentsme.info and finding out who your legislators are, increasing the number of people, who know who their policymakers are, and then getting into a habit and working with advocacy doulas like myself to help figure out how to raise your voice and be heard. And any of you that are having been past president of the Public Health Association, I know that a lot of us who have worked in community, government-funded programs, we often feel gagged. We often feel like we can't be advocates because of the titles and the funding streams and things they come from. But I just always want you to remember your time, your dime. And I may not go up to the Capitol and say, this is Sara Finger on behalf of the Wisconsin Alliance for Women's Health. But I can go up and say, I'm Sara Finger. I live in Fitchburg. I'm the mom of 2 kids. I have a stepbrother with autism. There are always stories I could tell, and no one can deny me that perspective. It's just a matter of, again, making sure that you're going in on for yourself and maybe not speaking on behalf of your agencies. But your voices are so critical to helping shape the policies at every single level. And while it seems daunting and it seems like, again, maybe you're not a good chef and maybe you don't want to go in that policymaking kitchen, the truth is, I'm not good at cooking, and I'll be the first to tell you, I'll go into that kitchen, that policymaking kitchen, I'll fold the napkins and pour the wine. So come join me, even if you're not a sous chef.
I could say a little bit to Michelle. You know, you call this back-end support, but consider the following. Over half of the families that are receiving the child tax credit now claim that they have emergency savings. The next time that something happens, they can pay for it without doing a payday loan or without going into some other area like that. In the last 4 months, over 1 million children in Wisconsin their parents have been given over $1 billion, which they can spend on those kids. And they've been spending it for food, first of all, greatest need, but for rent, for childcare, to get kids ready for school, to buy them the things that, that other families can, find easily to afford. So we're doing what we can. We have the earned income tax credit to support and make work pay higher than it would be. The new child independent tax credit means that if your income's below $100,000 a year and you spent $8,000 on your child's childcare at a licensed provider, you need receipts, you get $4,000 of that back, in addition to all these other benefits at tax time. And I know the front end is important. Many of us have pushed for, we have a very low minimum wage here. But the way labor markets are working right now, wages are rising at the bottom. People realize that you're going to have to pay. If you want me to work this job that's insecure, that may be dangerous, you're going to have to pay me to do it. And that's what's going on right now. So labor markets are working in favor of people. But my last thing is just to say that, all this back end support, when you get a great recession or a COVID recession where incomes drop from the middle class and other people, we have these other programs there to help, and we have to keep them. That's, we've made some inroads. We have the child tax credit is helping middle and lower income people, and we need to keep that along with the higher SNAP benefits and make sure that they get to people who need them. That's all.
Hey Tim, could you say, it's an excellent point you raise. Can you say a little, and for context, for us to further understand sort of this distinction between the back end and the more systemic supports? Can you talk just a little bit about how we might compare to other Western industrialized countries on that front? Because I think that helps reveal a little bit about what you're getting at.
Well, we have the highest child poverty rate among all the Anglo-Saxon countries. Everyone knows that. And the Canadians, who instituted a child benefit, cut their child poverty rate from 15% to 10% in 2 years after they put their child tax credit in and kept it. Okay. Work supports, people who get the child tax credit don't stop working. It allows them to work more and to work better. They can stay at home. The most insecure time, as Sara knows full well, is right when the baby is born. So when the kid isn't 1 year old, isn't even 1 year old yet, who's going to support you to take care of that child and to build a healthy bond with that child? Well, that's the child tax credit is there to help with at least some of that. And obviously the Women's, Infants, and Children's Feeding Program is there. The SNAP program is there, and so forth. So those are all things that, that we get out of these policies. Other countries have them. Certainly they have better childcare systems and better childcare subsidies. That's an important thing to do too, I know. And most of them and big employers have family leave provisions, which not everyone has. So the issue right now is that the president is trying to go for all of them at once. And it's not going to be easy. Not everyone is going to get what they need. Nothing's going to happen to the SNAP program. It's off the table. This was an internal decision to raise the benefits. How it's administered is still up to the states. But to extend the child tax credit for another 3 years or so, at least 3 years, so that people can use to building this support every month into their savings plans and so forth is really important. You may call that back end, but to me, it's labor markets will treat you the way they do. You can work. Hopefully, you won't get sick. But we have these, at least some safety net there to protect families with kids. And this includes grandfamilies who are taking care of their kids. This includes, I've spoken last week, Doua, I had a whole seminar with the Hmong population up in Wausau that Corinne Norbroom put together for the community health workers and Latinos and everybody else. People are having a hard time realizing that if their child is born in the United States and is a U.S. citizen, has a social security number, they are eligible for the child tax credit. No one's going to report you to ICE. This idea of public use that you'd lose some access to a green card or to other immigrant provisions because you're a public charge, because you used a means-tested program like SNAP. That's all gone now. That's out. But convincing you need trusted people like Doua and others in the Latino community to tell their people, hey, it's okay. Apply for this. Here's people like Brad's people at WISCAP, Wisconsin Extension, people in Lebanon. Here's people who can help you get the benefits that you deserve and you need. And so that's what's going on now. And that's really helpful. And again, I hope that at some point, less will be needed to be spent on food because people are earning more or because SNAP is paying for more and so forth, and more can be used to pay for other important necessities like rent and child well-being, inputs into children's well-being and so forth. So did that help, Brad? Is that what you wanted?
Yeah, it helped me a great deal. And one of the things that I see, to your point about these sort of longer term investments, to sort of recalibrate everyone's household budget. I mean, one of the things that we're seeing, and again, I kind of circle back to housing because it's what I know, is here's a moment where there is a very ambitious set of proposals to do things that we could, as housing advocates, could only dream about years ago. As you said, everyone's not going to get what they want. Very unlikely. Be trimmed down considerably. But in this Build Back Better proposal, at least, they're talking about a $327 billion investment in housing. I mean, this is, for those of us who have worked on this for years, we would get laughed out of the room if we asked for a 10% increase on any given program, any federal program. And part of the problem has been that it's been sort of stopgap housing. It's been, it's been maybe a Section 8 voucher here or there. It's been maybe a modest increase in a public housing operating fund, something like that. Now they're talking about actually building real housing, which hasn't been done for decades in this country with federal dollars, at least. In fact, it's been prohibited because of things called the Faircloth Amendment, which wouldn't allow us to build new public housing. So they're talking about major investments in building housing for low to moderate income households. And why that's important for this conversation is because most households, as we know, spend a disproportionate amount of their income on housing. It's typically the largest expense for a household. And so if we can figure out ways to make secure investments on that front, combined with what you're talking about over these CTC credits and others, we could really make a significant detour in the trajectory of where we're going. And this is probably the moment. This is the moment. So I'm encouraged that there's at least that imagination. Yeah.
The CTC is the biggest thing that's happened since the Social Security Act for kids. The biggest thing. It's Social Security for children, essentially.
Right.
Universal.
And add one more thing to it. Yeah. This may be something that we overlook, but in terms of food security. We at the Southeast Asian Healing Center, we partner with Groundswell. It's a land trust organization that bought land and in order either lease it to farmer or community members, and we work with them, and then they acquire land plot available for our elders to garden during the summer, and that helps bring in some produce to feed them. But it's getting to the winter again, and then farmers or mostly of the Hmong probably will not be able to garden anymore. So food will be an issue, food security will be an issue in the Hmong community. And then I would like to throw this out there that in the Wisconsin there are about 50 Hmong population in the Wisconsin, and many of them would like to, get access to available land that is just sitting there and not doing anything. Make those available for people who wanted to use it for gardening. That could be part of the food security to help with low-income family or people who can, grow their own foods to feed their family. And also, I would like to encourage Wisconsin Night or to support the farmers. And when you go to the farmers market, please help those farmers who are selling their produce out in the market, free markets or farmers market. So that would be great support to our community.
Yeah, thanks, Doua. That's good stuff. I'm looking at the chat feature and I don't see questions. I hope I'm not answering anyone's questions. If you have one, please drop it in there. If not, any other thoughts from our panelists? If we can end a little early and give you some time back if you don't have questions, but I want to make sure everyone has the opportunity. I'm not missing anything. Sara put in a great quote. I'm reading that now. Excellent.
Sure does.
Yeah.
And
I'll just add, I mean, and I think, like I said, Tim and I, we know like the CTC, like you hope that stays in, and I mean, it's making a difference for families everywhere. And you hope, that it's not subject to the next administration or changes nationally, right? We have to demand better policies at every level, downstream, upstream, wherever. And, it gets frustrating watching a lot of funders, want to put on financial literacy seminars for women. I see this all the time, and that's where, they get really excited to bring women together and let's talk about how you can be financially literate. Well, the problem is until we have, living wages and paid family medical leave and affordable childcare, what are you to be literate of? You can do all the financial literacy summits you want and the workshops you want. But, again, we have to look at all the failures. Like, what have we inherited from decades worth of failed policy making and systems change? And I really think, again, those of you on the front lines of any number of these crises and these challenges in our communities, recognizing that it's not just about, again, providing a meal for that moment, right? Like, how do we work together and collectively recognize all the different support systems that we need to connect people to start again, just to healing and getting people on a more stable track. And that's just my big takeaway, Brad, is that, for all of us, we all, again, often kind of put our heads down and work on our issue areas. But my dad used to be the HUD director for Wisconsin. And so I know housing. My sister's at Head Start. The more we can connect the dots, scratch each other's backs, and recognize that we shouldn't compete with each other for scarce dollars and crumbs, let's go after and make some pies.
There you go. Yes. Any final thoughts, Doua or Tim?
Nope, I think that's it for me. Thank you.
I just want to say to Doua that when all these people are spending more money on food, that raises the demand for the products that your people make. There are some farmers markets that offer extra bonus for using SNAP coupons and other vouchers. And I'm always happy in the Madison farmers markets to see your people there selling me fruits, vegetables, flowers, always with a smile and always high quality. So I'm really appreciative, and I hope that things can continue to get better for all the poor people.
I hope that too. Thank you.
Well, with that, I think we're all going to go bake some pies. And I appreciate everyone's contribution. Good discussion, good stuff, good work. Especially want to thank Stephanie for assembling this group together and for your participation in Feeding Wisconsin's ongoing work. So with that, I think we'll call it a wrap, and everyone have a great day. Enjoy spending some time with you.
Thanks, Brad. Thanks. Bye, everybody.